Early childhood care and education play a critical role in developing a nation's civilization by helping improve the quality of young people in the community. In an African society, early childhood care is a collective effort. It starts with active participation from the community, the teachers, young children, neighbors, and parents. In Uganda, due to different social and economic constructs, some communities struggle to provide a conducive, essential learning environment for the young, especially dealing with the after effects of the Covid-19 pandemic.
Our major contribution really came out during the time of COVID, when the whole country locked down on 20th March 2020 and only opened this year, January 2022. Children were home. So we worked with the parents to ensure that they continue learning even when they are home.
Indeed, early learning is considered to begin with the parent as the first and foremost teacher. In order to address the rising challenges due to the pandemic, a stream of initiatives and interventions were created to cater to the different groups in the community concerning early childhood development. These include peer-to-peer support to teacher through refresher trainings and cluster meetings.
This training is all about play, like child-centered methods, how you involve a child when you're teaching. I have 32 students, but the 3 are these disabled. There are some who have like family issues. So with these trainings, you get to learn how to handle such children, parents' approaches.
Our main work is to support communities, start and run ECD centers at low or no cost. Right now in Uganda, the Madrasa Early Childhood Program is mainly found in Wakiso, Kampala, then Mukono district. Wherever we go, we are focusing on early childhood development. Whenever we refresh, we find that at least there is some kind of life that is put into what they are doing. Most of them are new in this project. Why? Because they came in to replace those ones who left the system. So we thought that if we organize such a training for them, it will help them keep running, get reminded, and keep enjoying their job.
We gain skills of modeling, classroom control. We can now teach like effectively. We make sure that our lessons, the teaching learning process, like children play.
Teachers, just like Amidu, have managed to find a semblance of normalcy through the refresher courses and look forward to improving theirs and their pupil learning experience.
What I have learned from the refresher courses, I learned how to make lesson plans. I have delivered information to my colleagues. I have also learned how to make schemes of work, which have helped me so much to plan for my children.
To ensure that these refresher courses are implemented, a follow-up is done through cluster meetings where teachers get to share their knowledge and innovations to improve the learning experience among their peers and young children.
These cluster meetings basically is targeted for the learners and the teachers, even the parents. We sit down and we make materials for the learners, because it is easy to teach a learner when you have materials. A learner learns very fast when they touch and feel and also observe the color. When you don't go for how to do, they have to remind you, teacher how to do, teacher how to do. Before, we could be in class and it can be like counting. Children could not have enough like fresh cards to see the letters. But when we sit all together, we do produce a lot of materials. We have a session whereby we say a free choice. This free choice, we allow learners to go in all corners and pick, each one can pick what she or he want to play with. Girls, for them, they like going in areas like a home area, market area, because those things are so attractive for them.
Other interventions outside the classroom include parental involvement with the support of village health teams. With this initiative, parents are educated about child interaction, play, nutrition and communication.
Abazadde abamu babadde tebamanyi enkola eno naye bwe tutuuka mu maka tubeeyanjulira era ne tubabuulira n'ekitongole ekitusindise na biki ebituleese okubasomesa mu maka gaabwe ebikwataganako n'abaana bano abato.
Ono vyesti waffe atuyambako okusomesa engeri tulina okuzanyamu n'abaana bato, atuyamba engeri yotulina okukwatamu baana bato na balance diet n'ebirala.
Kikyuseemu endisa y'omwana, abaana baŋŋamba akawunga, emmere ebyomuwa maanyi n'engeri gy'oyinza omukoleramu ekyokuzanyisa nga kiri simple.
The Role Madrasa Early Childhood Program is the provision of quality early childhood development services, empowering the communities so that they can support ECD service provision at the community level. And we have impacted quite a number of children directly by reaching out to the children, and also indirectly through training the parents and training the caregivers. Our dream is to have all the children in this country active, happy, knowledgeable, and healthy. So that is our dream, and that's what we are working towards. So we shall continue training the ECD caregivers, those people who work with the children, be it within the home, be it in the schools, and be it at health centers.
This program aims to impact children's early learning by empowering parents, teachers, and village health teams with innovative learning tools and techniques to improve education in class and at home.